Welcome back. I'm really going to keep this one short. I'm going to react to a video from John from Active Self Protection Extra, actually. Um, so it's this video, and the title is News Story Discussions, one of the dumbest articles I have read on gun violence. When I read a title like that, I'm immediately curious, like, okay, did he actually research this? So we're going to
Hi everybody, welcome to Active
watch this
Self-Protection
video.
Extra. Today, I read an article on the Trace. It is titled, Gun Violence Linked to Surprising Side Effect, Poor Dental Health. Gun violence causes poor dental health. A new study shows...
Like, the title alone is like, kind of like triggering him, right? Like, he's like, gun violence linked to dental health? Like, what? Like, that doesn't make any sense. That's it. So let's keep watching.
Between gun violence and oral care.
The point I'm going to make here, and then follow along with me, is you need to put in some effort to read papers, studies. Like, it requires a little bit of effort. Don't just read one article. Try to see if you can find it and read the study. A lot of times there are like really short papers. Takes you like half an hour to read them. Let me also tell you that if you studied at the university, you've had like statistical analysis, like SPSS, which is like software. Like you've had maybe some classes on statistical analysis, right? You've had to do this type of analysis. I've had to do it multiple times. It's been a while, so yeah, I don't do it that often, but I understand how it works, right? So let's watch.
It expands our understanding of how people respond to shootings. This is one of the dumbest damn things I've ever read in my life, and I want to talk about it. I've put a link to this study, this story in the description, and it was written by Fariona McGee. And it says, Fariona is the public health reporter at The Trace. Previously, she created a newsletter focused on health disparities and environmental injustice, all right? It's covered a range of topics, including public safety, climate change, and food insecurity as an undergraduate and graduate student. Great, all that's fine. She has a graduate degree from...
Let me be very clear. I like John. I think he's a cool guy. He's a cool guy. I'm not a fan of guns. Like, I mean, I can appreciate how they're built and stuff like that, but I'm glad that it's not a thing here, like it is in the US, but fine. I like the guy. And it's just such a stupid video.
From the Missouri School of Journalism, specializing in science writing. This is not science writing.
It is science writing, right? So she studied at the School of Journalism, right? She has a graduate degree, specialized in science writing. Like, she probably has an idea of how to write about like scientifical like discoveries and stuff like that. Like, it's not that complicated, but she knows how to read a study. One would assume, right?
This is utter trash. Now, I want to explain why, because
it's so fun.
It's the most glaring
I like this the most. Like, this is the part that really sticks out to me.
Stupid error here I could possibly... How you missed this is...
Did they miss this? That is the question that we're going to answer, right? Did they actually miss this? He's going to give us some time to think about it.
Is beyond me, okay? Just in her opening sentences, for decades, the effects of gun violence exposure on overall physical health has largely been overlooked, but a new study shows a startling link. In communities with the highest rates of gun violence, residents are less likely to receive dental care. She goes on in this entire article to talk about how the dealing with a life filled with violence, and gun violence in particular, gets people where they don't care as much about their oral health. And of course, a lack of oral health has been shown, and a lack of dental care can lead to other health problems, that our lack of dental care can cascade into other health problems. And you know, this research expands on scholarship that has tied higher levels of gun violence in communities to higher rates of diabetes and food insecurity.
So it's not just dental care, it's also diabetes and food insecurity, okay?
I'm gonna give...
He's gonna give us some... I want you guys to take
you a
the time.
second, and I just wanted to ask you,
Think
what do you
about this.
think she's missing here?
What is she missing? She's like the journalist that is writing something about a study that is done by other people, right?
What is the giant link that she is missing that is so obvious it's like the nose on my face? Poverty.
So the rest of the video is him just explaining, like, it's poverty. It's not gun violence. It's poverty. It's poverty, you idiots. Don't you see? It's poverty. How did you not take into consideration poverty? Um, so we're going to go to trace. We're not even going to watch the rest of the video. I mean, we could. It's just so stupid. So this is the article that she wrote. I'm not even that interested in this article. When you hear about a study and you read an article about a study, you Google the study. Here, when I click this link, I actually get like a warning, like, I don't know, so I'm not clicking that. So what did I do? I just searched for the title of this article, and the second Google result gave me a link to um, a university or something. And like, oh, that one also had a link to the art, to the paper, to the study, right? So I'm like, okay, let me try that link. And it's like, oh, okay. So we have an abstract, we have an introduction, we have tables, we have data. Interesting. We have sources as well. All right. So did they consider poverty? You would ask now, right? Because he's saying like the journalist is an idiot for not considering poverty. Here's the thing, John. She's the journalist. She's just writing about the research, but the research is done by other people. Please look into the study. So let's control F and search for poverty. Oh wow, poverty is right here. Let me read. Let me zoom in. Several indicators of community disadvantages, the disadvantage theoretically related to community health and gun violence were included using annual estimates from the ACS. The percentage of families in poverty, the percentage of family households with a single female head, the percentage of people in the labor force and unemployed, the number of households receiving public assistance, and rent burden, right? The percentage of households spending more than 30% of their income on housing. Due to collinearity, like you can look it up and learn more about statistical analysis, between several of these items, a weighted community disadvantage score was created by creating a factor of poverty, single-headed families, and unemployment. The remaining items were included as separate independent variables. So they created this variable that covers poverty, right? It's like a combined variable, a weighted one. So, like a weighted one, basically what I just mentioned, like some of them are weighted higher and lower. So yeah. Additional covariates from the ACS were included. The tract level percentage of the population who identified as non-Hispanic white, an indicator for each of analysis was included, as well as binary measure whether it was a COVID year, blah, 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 blah. Statistical analysis. So you can go and look at, the tables. I'm not even going, I don't care, right? I really don't care. I'm just checking what he is saying. Did they completely ignore poverty? All right, we have the tables, and then we can just scroll down. We have more tables. So if you're really interested in what the study has found, this is what you go and look. You look into this, right? Okay, so let's see. Let's just go to the discussion because that is interesting. One potential explanation for the lower rates of dental care use in neighborhoods with high firearm violence is the fear residents may feel and concern for safety when accessing services. Individuals in these areas might avoid leaving their home or traveling through dangerous parts of their community to seek dental care. This is consistent with research showing that violence can create barriers to accessing healthcare more broadly, particularly when individuals fear for their safety while traveling to healthcare facilities. You see those numbers next to the words and the sentences? It's basically like, here's the source. So we're using a different study where this already came up, like, yeah, it's to verify this as well. Additionally, to the extent that high rates of firearm violence are associated with a reduced number of dental clinics within communities, it is possible that the findings of lower dental care utilization are due to a lack of access to dental care services. Lots of gun violence. Dentists do not want to set up shop. The elevated levels of edentulism among those aged 65 years and older observed in neighborhoods characterized by greater firearm violence suggest that the lack of dental care may have long-term consequences for oral health. The higher rates of tooth loss in areas with greater firearm violence may be a consequence of prolonged dental neglect, resulting in more advanced oral diseases going untreated. Alternatively, considering findings that community firearm violence is associated with poorer health behaviors, like physical activity, obesity, the findings may be in part due to chronic stress and maladaptive coping behaviors to firearm violence. While the current study could not parse out the precise mechanisms that explain the link between community firearm violence and worse community level oral health, future research should explore the specific pathways through which firearm violence disrupts access to dental care and oral health outcomes. We'll keep on reading. To address dental care disparities in communities impacted by firearm violence, dental practitioners and researchers should prioritize developing targeted policy initiatives and interventions. One potential approach is the expansion of mobile dental clinics and community-based dental services for communities experiencing high rates of firearm violence, which could reduce the need for individuals to travel through unsafe areas to access care. Yeah, good idea. Additionally, integrating comprehensive, high-quality dental care services into existing community health centers and violence intervention programs may help improve oral health in these high-risk neighborhoods. Policies that enhance insurance coverage for dental services, particularly for those living in highly violent communities, may also be beneficial. Many states lack Medicaid coverage of routine dental care for enrolled adults, and Medicare does not cover routine oral health services for older adults. Adults frequently obtain dental insurance through their employers, and if they lose their jobs, they no longer receive coverage for dental care. These gaps are particularly detrimental to those living in communities with high rates of firearm violence and already experience greater dental health challenges. Utilizing community health workers in high violence communities could play critical. You get the gist of it, right? Limitations. The study has limitations that can be expanded upon in further research. First, despite using recent data, the analysis is restricted to 9 years of data. As additional years of data are collected, future studies can examine longer-term trends in the relationship between firearm violence and oral health. Second, the only available measure of oral health was edentulism, which is measured only among individuals aged 65 years and older. Yeah, so there are some limitations to the study, and they are supposed to mention those, which they do. This measure is somewhat imprecise since once a person becomes edentulous, they remain so, and that cannot be changed. People may have also become edentulous prior to 2014. So here you can read all about the limitations. Conclusions. This study pioneers a new direction in dental public health research by demonstrating a connection between community exposure to firearm violence and lower levels of dental care utilization, as well as poorer oral health. So, and also the findings extend previous research that links community firearm violence to adverse physical and mental health outcomes. Living in an area where there is like firearm violence, yeah, it has an impact on a lot of stuff. So I'm not going to explain to you how statistical analysis works, right? There's a p-value to see if it's significant or not, 0.005 typically. So you can learn about statistical analysis, right? They have done that research. They have used the tool to determine all these percentages and to rule out like, oh, this is just a coincidence or whatever, right? So either it's statistically significant or it's not. Based on their p-value of 0.001, if I'm looking at this, what is it? Yeah, it's like, it's significant. Like they're saying there's a significance, right? So there is a link. So you can research it more. P-value less than 0.001. The way I remember it, it was normally 0.005. So this is even lower. So it's like even more significant, I would assume. It's been a while since I done some statistical analysis. But when someone publishes, like we will listen to the rest of the video. He makes fun of the trace, which fine. Like I didn't even read the trace thing. Like, but clearly you did not go to the paper, and it's right there. It's online. You can read it. So you can make fun of the trace, but you're actually making fun of the study. But you didn't take the time to read the study, and you probably don't have an idea of how statistical analysis works. Like they're taking it into account. Like,
guess what?
What he's saying is like, it's poverty. That's it. Poverty explains all the bad things that people experience. So let's not study anything anymore. As soon as we can just link it to poverty, like, well, poverty explains it. Why would we research it more? Well, as you could see, they came up with some ideas. Like, yeah, can you imagine if there is like firearm violence, like people are getting shot in the street, that some people are not getting out of their house if they really don't need to, and they're like, you know what, dental care, I don't care, because it's not worth it for me. I'm not gonna risk going to that dangerous location, or it's really far, or whatever. Yeah, you could link a lot of things to poverty, but the reason why there are studies is because there is more. Like, you can find out more, and the results force you to think about it. Like, what it okay, I'm finding a relationship here. There is a link between these things. How can I explain this link? Because that requires some creativity, but also, like, you really need to like explore it and think about it. It's part of the study, right? They're supposed to do that. So yeah, poverty has not been completely ignored in this study. That's not true. They've included it. It's not just poverty, it's the actual gun violence.
In communities where there's higher rates of poverty, there is higher rates of violence in general. When you get high
Violence in general. Okay, so gun violence, getting shot because they're shooting at each other and then the bullet hits you, is now put in the same category as someone is going to beat you up, right? Like, there is a difference between accidentally getting shot because people are doing drive-bys and stuff, and someone beating you up. Like, they're directly beating you up.
population density and high poverty, you get violence.
High population density, high poverty, violence, and everything sucks. No need to study anything anymore.
Okay,
It's just high population density and poverty. That's it. Those are the two things.
that.
So, like, it's like a magic solution, right? You just need to make sure that poverty goes down, and then it will improve. Like, yeah, we need to make sure everyone is richer. That's it. You should not do any research studies.
And where do you see that? I know, if you watch the main channel, Sao Paulo, Brazil, has huge levels of violence. Why?
It's not about Sao Paulo. It's like this is a study done on the U.S. Like 200 cities or whatever.
You have four
It's
times
the
the population
US.
density of Los Angeles, and you have abject
It's
poverty.
the U.S. If you look into the study, they're looking at U.S. cities. So you're supposed to look at
in the
U.S.
favela.
cities here.
So what do you get? Crazy levels
It was not part of the
of
study.
violence. When you get high population density and poor people, they
Probably, if they look at cities in other countries where there is high gun violence, probably the same thing will come up, because people are worried. They're scared to go to the dentist, and there is no dentist in their neighborhood because people get shot all the time.
they are going to prey on each other. At least a small subset of them respond to that and cope with that by preying on others. Most people don't. Most people are good people and they just work hard to try their best to survive as best they can. But a very small subset of them will prey on other people and have a high population density to do
They're not going to the dentist because people are preying on them.
so. And the study published in the American Journal of Preventative Medicine, this journal was published in April. Oral health and firearm exposure. Using data from CDC, its authors analyzed more than 20,000 census tracts within 100.
So it's just reading the article referencing the study while the study is just there available, because this video is from the 17th of June.
Largest cities in the United States from 2014 to 2022, they found that a 1-point increase in shootings led to a 0.06% increase in dental.
I guess maybe here he sees like, oh, it's only 0.06%, so that doesn't sound significant. That's why you have that p-value. Like scientists, like people that do statistical studies or doing statistics, that's the method.
Loss.
And you can increase the p-value or decrease it, and there's like 0.005, if I remember it correctly, was like, that is what most people use to say it's significant. Otherwise, they will say like, it's just, yeah, it's not really significant. There's no link.
What?
You haven't looked into statistical analysis. my
What?
dude.
The researchers found that factors like a pervasive sense of fear, chronic stress, and social and economic disruption brought on by firearm violence could potentially
So the details of this you can find in the actual study.
contribute to adverse health behaviors, poor oral health, and affect access to dental care. Friends, you're talking about people in poverty.
It's poverty. It's just poverty, friends.
And those folks don't tend to get dental care.
Just make them richer. Give them money.
Because
Make
they
them
have
rich.
far higher priorities like food.
That's the
Far higher
solution.
priorities like rent.
That's the solution. They took that into account, right? You want to go to the poverty section here, right? Food, So poverty, rent, he talked about rent, all right. Single female head, percentage of people in the labor force and unemployed, number of households receiving public assistance, rent burden, the percentage of households spending more than 30% of their income on housing. Yeah, they talk about that stuff. And he's like, you have not taken that into account. That is not true. They have that data. It's there. It's there. They're referencing it. And like if I scroll down to the resources, like here, inequities in community exposure to deadly gun violence by race, ethnicity, poverty, and neighborhood disadvantage among youths in the United States. So they're linking to other studies that are covering those things as well.
Authorities like trying to maintain their ability to travel via a bus pass or a car that they have to maintain. They don't have money for what they.
You're just coming up with stuff that is not linked to gun violence. You having a bus pass or not is not linked to gun violence. You being afraid of going to the dentist is linked to gun violence.
See as frivolous, like dental care, that is not a pressing need, like other medical care, because they're working poor. And I just not seeing that and trying to put a link between, well, if they've been exposed to gun violence, they lose more teeth.
So with statistical analysis, these type of studies, they're not searching for something and like, oh, I need to prove this, right? They might have like a hypothesis and they're like, well, let's see if there is a link. Yeah, that could be it, but they're not if they are manipulating the data to get the outcome that they are expecting, that is fraud, right? People get exposed if they're doing that. They're using data that is publicly available or can be accessed by people that are doing peer reviews. These studies typically have peer reviews. Someone else needs to check, and before it gets published in a journal like the American Journal of Preventive Medicine, which I'm not familiar with, but yeah, like you typically, they have to check your work, right?
And not recognizing the humongous confounding factor of poverty.
It's not just the tables and like
overall
that text.
Poverty.
They need to check your
stupid.
research.
It's just pants on head stupidity. Now, there's some things at the end here.
Pants on head stupid.
That says, wait a minute, access to care is a huge component of public health. And whether we're speaking about oral health or overall health, including violence exposure, we have to work at addressing these disparities and disseminating information. Yeah, I think getting good health care and good care in general to poor communities, making sure they have access to good medical care, preventative medical care.
Like he's a nice guy. Like he has good ideas. Yeah, we need to. Yeah. But the idea, like getting the idea of like, hey, we need mobile dentists. If there are no dentists in those areas and they feel unsafe to go to a dentist or whatever, yeah, you get to those ideas a lot of times. You get to those ideas by doing these type of studies.
Good nutrition, great education, helping folks to live healthy lives. I'm for all that stuff. So when the end of things, you're like, well, we need more mobile dental clinics to go into poor communities. Cool, I'm down with that.
Okay, so he mentions that, but do you see the link to with not like being afraid to go to the dentist? So that's why they're coming up with this. So there's a link to gun violence.
I don't want somebody to have an abscess tooth and that lead them to missing significant days from work, getting kicked out of their house, and experiencing homelessness, right? Those are all significant, serious problems. And working on those economic disparities is cool. I just think doing stuff like this and connecting, well, when they've been exposed to gun violence, it leads to dental health problems. When there's a huge confounding factor sitting there right in your face that you apparently didn't consider, which is
didn't consider poverty, guys. They didn't consider poverty. It's a variable in the study.
Giant confounding factor. It's just pants on head stupid. So when you read crap like this, and the Trace is generally an absolute rag that has zero just credibility in my opinion because they do crap like.
The Trace did not do the study. They're just reporting on the study, right? It's the American Journal of Preventive Medicine.
This all the time, this journalism. I think Fariona McGee, quite frankly, if you've got a degree in journalism, shame on you, madam.
You can criticize her for not, like the article is not written good, like whatever. But dude, go to the actual article. And here's the thing. No one is going to confront him about this in the comments. Obviously. Because all of these people do not actually go and look at the study. So let's read them. This is why I brush and floss daily to prevent gun disease. Recognizing that correlation is not causation would eliminate much of the stupidity in print and hours of research. Yeah, I'm not going into that. So when you're doing statistical analysis, you're taking that stuff into account. Yeah. Okay. Breaking news. Researchers with an agenda find links where they want them. Oh, they're just against guns. When I first read the paper, I'm not sure if you actually read it. I thought, who funded this research? What a waste of time, effort, and capital. Cause and effect is a simple principle that this author does not come. She didn't do the study. Correlation between dental health and crime is well known, but it isn't causation. Okay, so being afraid to go to the dentist does not play a role. It's just that poor people do more crime, and they have worse teeth. They have worse teeth because they're doing more crime. Because poor. If a poor family gets good dental care, they are likely not the crimey type of family. He liked this message, my guys. He liked this message. He liked this message. They're just doing crime. That's why their dental care is really bad. Wow. Some ideas are so dumb it takes an academic to come up with them. In communities with high gun violence, they are discriminated against by Lamborghini dealerships. What a clown world. I'm married to a Brazilian woman who hails from Sao Paulo. I made 5 trips down there to visit the in-laws, and I can vouch for the crime, violence, and abject poverty. Yeah. Science writing. There was a lot during COVID journalism scholarship. Okay, let's keep going. Bill and Melinda Gates, or the person that wrote the article is a product of her college education. She didn't do the study. Should we ever meet, John? I'm going to be looking for your false teeth. Let's see how he responds. All natural. That person is proof that the earth is round. Reason is dumb people will walk. Thanks, John. That is indeed pants on hand stupid, says William. It's time for less Rons because violence is also linked to increased ice cream sales. I remember this one. Glad another channel is covering it. There's an established correlation between ice cream sales. Again, owning guns improved my dental health. I realized if I took such care. Ha 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 ha. It's things like this that convinces me that some people have truly lost their minds and would never ever regain it. That if they ever had a mind in the first place. This reminded me of the theory of spontaneous creation. I don't know. In a former life, I was a pharmaceutical chemist, not the Breaking Bad kind, the State University of New York. Too long. Any basic class in statistics will say, at some point, correlation does not prove causation. Was this the onion? I'm a working poor single dad. I've had state health care, no dentist within 2 hours of where I live. I will accept it. We have a dental school here and I will accept it so the students can practice on you, okay? Basically, the current state of social sciences seems to me that if they are serious about gun violence, they would focus on poverty. So they can't comprehend poverty. Yeah? That it's all that I can muster as a response. Common sense and critical thought have left the building. Poor dental health is probably a result of lack of a job with good benefits. That's it. Yeah. So anti-gunners and dentists got paid for this study. I wonder what university she attended. She didn't do the study. I do think that poverty does lead to dental issues, but poverty also leads to gun violence. However, somehow these same people have the most expensive phones. Okay, next one. The study should be income based. Hey John, I would like profit from a video on disarming when you go in someplace illegal to. Okay, let's keep going. I'll take political bias for $1,000, please, Alex. The fact that hundreds of thousands of people actually believe that article is absolutely asinine. What the article is avoiding is the fact that there's a common trait among a certain subculture of people tied to both gun violence and poor dental care. Oh, so it's a subculture. Racist, stereotyping, and dog whistles. A classic a merry fat trait. Yeah, we have a racist comment here as well. Learn to read a research. Explore what statistical analysis means, right? How does it work? What is that coefficient 0.5, or in this case 0.1, that determines something is actually significant or not? Dive into it. Maybe copy paste the entire thing into GPT and ask GPT questions like, did they actually take into account poverty? And GPT will say, yes, they did. But how did they do it? Well, they did this. I don't understand what you're saying. Oh, let me rephrase it. Oh, I kind of get what you're saying now. So I was wrong by saying that they didn't include poverty? Yes, you were wrong. Okay. So you learn. I don't want to spend more time on this. It's just stupid. Thanks for watching. If you like my coverage of these type of videos, don't forget to subscribe and hit that like button if you agree with me that people should take the time to actually explore a study Try to find the paper, read what they actually did, instead of just reading the news article that is covering it, right? You have access to a lot of research papers. So take the time to actually explore it. And if you don't get it, because you've never learned anything about statistics, just ask GPT. Do the effort and ask GPT instead of just immediately jumping behind your desk and saying, oh, I have an amazing topic for a new video. Hit the dislike button if you think there is no link between these things. If you want, yeah, if you disagree, comment on the video. Let's have a discussion. Thanks, guys. See you next time.